This video is about Mental Health Awareness Month, talking about things that you would need to know. The main thing to understand is that I'm not a psychologist or psychiatrist, but I do a lot of psychology and psychiatry simply because what I do for a living is very tied in with our psychiatry or psychology. It's how we view ourselves. No one needs to have a facelift. No one needs to have a rhinoplasty. No one needs Botox. Yes, okay, there is, of course, Botox for migraines or for pain, which is more of a necessity in my opinion. However, when I'm talking about mental health awareness and talking about the cry for help, a few things I wanted to differentiate for you out there is that these procedures won't make you happier. And I like what my mentor always said is happiness comes from within, which basically means that if you're not happy with yourself right now, a rhinoplasty won't make you happier. However, I'll tell you, if you said, look, hey, I've always been bothered by my nose, it's something that would make me feel better about myself if I did it, go for it. I think it's great. It does make people happier in that regard. Jonathan Haidt wrote a book called The Happiness Hypothesis, and in this book he actually found that plastic surgery, cosmetic surgery, can lead to years of happiness for people. And that being said, though, if you're internally unhappy, it's not going to just change your worldview, okay, in that regard. You have to already be a happy person, and it can make you happier, but it's not going to provide you happiness, and that's something you really need to know. Another condition that is more severe is known as body dysmorphic disorder, or BDD for short. This is a condition where someone has an over obsession with one body part to the point where it provides or causes restricted social activity or social interactions, meaning that you can't go out in public because you feel like your nose is too big, or people are staring at your lips, they're off, or your eyebrows are crooked and people are staring at. Now, that being said, of course, if you've got a cleft lip, or you've got a facial paralysis, or you've got a scar going down your face that's very obvious, of course, that may not qualify really as body dysmorphic disorder, because there's really a true deformity there that's causing you to have restricted social activities. But what I'm talking about, I'll tell you a story that may help you understand this. I had a gentleman that came in for consultation, and he would not make eye contact with me, no smile on his face. Very pleasant gentleman, though. He wasn't rude or abrasive, but he was looking like this and very sad. I said, so, why are you here? Well, it's my ear, as you can see. Well, I couldn't tell. His ears looked normal to me. They weren't even sticking out much. He goes, no, my ear is too far out on one side, and I just don't feel this is right for me. And so, of course, I went through the questionnaire. Is this affecting your social life? Because I couldn't even see what's going on. And if I can't see the problem, it's not going to help him. So it turns out he was shamed as a child for having one ear that stuck out more. And what's really interesting is they look normal. I don't even think I could bring one back and make it even a difference. So I do unilateral otoplasties all the time. I just did one a couple of weeks ago on a gentleman that flew in, and I got a really nice result. I was able to put that on social media. So it's not that I don't believe in doing one-sided otoplasties. First of all, I couldn't see the problem. But second of all, even if he came in with an ear sticking out more, his disposition, the way he was so restricted and so worried that I could see no matter what I did for him, he wouldn't have been happy. So it was very interesting. A colleague of mine wrote a really wonderful book about body dysmorphic disorders. He is a retired rhinoplasty surgeon who did wonderful work. You can get it on Amazon. His name is Mark Constantian. I actually cannot remember exactly the name of the book, but it's about body dysmorphic disorder and cosmetic surgery. He's done a lot of lecturing on this. What he found was very interesting. The root of BDD is oftentimes in childhood body shaming. Sometimes parents saying you're too fat, you're too ugly, your body is ugly, or whatever it may be. And it can so that's part of it. It can also be related to sexual abuse. And again, I'm sorry if that is your situation. I'm not making light of anything. I'm just trying to have you understand this is sometimes rooted in sexual abuse or physical abuse as a child from oftentimes a loved one or parent, which unfortunately is usually the case. I was honorary chair of the Dallas Children's Advocacy Center. I'm doing a painting for that charity. It's something it's dear in my heart. My wife was physically abused, hit as a child by her father, and so I have a lot of personal resonance with this. Of course, I have 2 children of my own, and so it's something that it holds a lot of personal passion for me, is to protect my children from this kind of abuse. So unfortunately, if you suffered from this, and this is the reason you have body dysmorphic disorder, first of all, surgery is not the answer. Fillers are not the answer. Botox is not the answer. It won't make you happy. You need to go and seek professional counseling from a psychiatrist or psychologist that can help you with your situation. So again, if you've got half of the face missing or something, you know, there's a hole in your nose where, you know, that would definitely qualify as someone having a deformity. That's different. But if you feel like your nose is slightly crooked and you feel like everyone's staring at you wrong, there could be a psychological root for that body dysmorphic disorder that you need to know about. So this month, which is about mental health awareness, it's really about understanding how we can be more sensitive to those that are having the situation. But as important to that is making sure that if I operate on you or if I work on you, surgical or non-surgical, that I do it for the right reasons, because at the end of the day, I want to be happy, you want to be happy, and hopefully this video was helpful for you.